Hello everyone, my name is Daysi Zentner. I am a PhD candidate in counseling psychology at McGill University, and I am a doctoral intern in psychology at the Emotional CBT Clinic. So today I will be introducing what is anxiety and talking specifically about what social anxiety disorder is. In a second part of this presentation, I will be talking about how do we treat social anxiety disorder from a CBT perspective. So, it is quite and very important for you, as a first step to really understand what is happening to you when you're feeling uncomfortably in social situations. And so all of the worries and physical feelings that you're experiencing have a name, and that is anxiety. And anxiety is very normal and a very adaptive and evolutionary way of our bodies to respond to danger because it really helps us prepare for danger. So, for example, our hearts beat faster in order to pump blood to our muscles so that we have, for example, the energy to run away or fight off danger if that were the case. And so really the goal is not to eliminate anxiety, but more to learn how to manage our anxiety. And so anxiety can become more problematic when our body is telling us that there is danger when there is no real danger. So there are different types of anxiety disorder. So there's panic disorder, agoraphobia, social anxiety disorder, a specific phobia, and generalized anxiety disorder. And social anxiety is the second most common social anxiety disorder right after a specific phobia. And so what is social anxiety? So people with social anxiety tend to fear and avoid social situations. They're very concerned that they will do something embarrassing or that other people will judge them. And so it's normal to feel anxious in social situations from time to time. So for example, most people feel anxious when they have to speak in front of a large group. But it's important to know that, social situations really include any situation in which you and at least one other person are present. And so social situations tend to fall into two main categories. Some that are performance situations and others that are interpersonal interactions. And we're going to be talking about these two later. So really the attention on other people and the attention is focused on how we are doing, right? And so we have this belief that people are very judgmental and also have this belief that we're not good. So someone who has social anxiety has commonly these two beliefs. Now, it's also important to make the distinction between introversion and social anxiety, because, introversion really is in terms of personality. So there is this spectrum between introversion and extroversion, and people, are somewhere in between. Now, if you're more on the side of introversion, then you might be someone who really enjoys solitude time. You might need time just by yourself, and you might find that very relaxing. And you can go to a party, do a presentation, do something in the context of a group and really enjoy it. And, but for you, it might be more energy draining. And so you might go have a lot of fun, but then you have to come home and really relax by yourself in peace. Compared to someone who is more on the side of the extroversion, who a party for them might be really recharging their energy. And so spending a lot of time alone is actually more draining to them. So the introverts really crave more time alone, and this is really a preference, right? And that is quite different, and that is what makes it different from social anxiety, where when you are socially anxious, you spend a lot of time alone, but that is only in order to decrease your anxiety. Because if you went out, it would be very anxiety provoking. And so you either feel like you cannot go to a party, or if you go, it might involve a lot of distress. So, when we think about the difference between introversion and social anxiety, it really focuses on this, like, someone who's introvert really is related to a preference versus social anxiety really is driven by anxiety. So the diagnosis of social anxiety disorder involves, having a marked fear or an anxiety for over 6 months about one or more of the following three social situations, such as having a conversation, meeting new people, being observed by others. And the individual that fears that they will act in a way or show anxiety symptoms that will be negatively evaluated. So they will think, that they will feel humiliated or rejected. Now, the social situations almost always provoke anxiety. The social situations are also avoided or endure with, intense anxiety. And anxiety is out of proportion to the actual threat posed by the social situation. And there is a specifier specific for performance only if the fear is restricted to speaking or performing in public. So, like we said, there are any social situations. There can be performance situations or interpersonal interactions. So, in terms of performance situations, are where people feel that they're being observed by others. And this can be, public speaking, so presenting at a meeting. This can include eating in front of others, participating in a class by asking or answering questions, by using public washrooms, writing in front of others, and this might include signing a check or filling out a form, performing in public, such as singing or acting on a stage or playing a sport. And this can also include entering a room where everyone is already seated. And interpersonal interactions are situations where people are interacting with others and developing closer relationships. So, for example, meeting new people, talking to coworkers or friends, inviting others to do things, going to social events, dating, being assertive, expressing opinions, talking on the phone, working in a group, working in a project with other coworkers, ordering food at a restaurant, returning something at a store, or having a job interview. And so, like we said before, it's not common for people to fear some social situations and feel quite comfortable in others. So, for example, some people are comfortable spending time with friends and family and interacting socially with coworkers, but they're very fearful of performance situations, such as participating in a business meeting or giving formal speeches. So also some people fear only one single situation, such as public speaking, while others fear and avoid a wide range of social situations. So what does social anxiety look like? So when faced with a fear social situation, people with social anxiety experience some of the following. So some of the negative thoughts. So what are they thinking, right? And so people with social anxiety tend to have negative thoughts about themselves. And so often they will just say, I'll have nothing to say, for example, as well as they will think about how others will react to them. And so, for example, others will think I'm weird. So people with social anxiety also tend to focus their attention on themselves during social situations. And they focus on their performance and how anxious they feel and look. So, for example, they might say to themselves, I'm going to say something stupid, I will get anxious, and others will notice. They won't like me, others will think I'm stupid, I will offend someone, or no one will talk to me. Now, you might also experience some physical symptoms. So, this is really what you feel. And so, people with social anxiety are often very concerned about visible signs of anxiety. So, for example, racing heart, upset stomach, shaking, choking, sweating, blushing, trembling, etc. So, they're really concerned about how visible their physical symptoms will be to others. Uh, Now, it also includes avoidance and safety behaviors in which people with social anxiety will often engage. So, they will often try to avoid or escape social situations. And if they were to go to a social situation, they will tend to do things to feel less anxious or to protect themselves from embarrassment or negative evaluation. So, for example, if I'm worried about saying something stupid, then I might just try to avoid talking altogether. And so, like we said, really it's normal for people to feel anxious in social situations from time to time. We all felt anxious in some situations. Many people might feel quite anxious in job interviews or when having a formal speech. But social anxiety can be a problem when it becomes too intense or it starts happening too often. And when it does, social anxiety can really get in the way and can cause significant distress and affect many aspects of a person's life. So, including work and school, for example, people with social anxiety might have difficulty with job interviews, problems interacting with bosses, their coworkers, um, teachers, trouble, answering questions during a meeting or during class, refusing job promotions, avoiding certain types of jobs or career paths, mm, you know, um, performing poorly at work or school, and really showing a decreased enjoyment of work or school. It might also affect the relationships. So, they might have more difficulty in developing as well as in keeping friendships and romantic relationships. They might have trouble opening up to other people, difficulty sharing their opinions. Um, it might also have impacts in their recreational activities or their hobbies. So, for example, they might try to avoid trying new things, avoid taking classes or lessons, avoid activities that involve interacting with other people, such as going skiing or going to the gym. And it may also interfere with other day-to-day activities. So, for example, having more difficulty completing day-to-day activities such as going to the grocery store, going out to eat, taking the bus, answering for directions, etc. So, in general, they're very important contributors to social anxiety, and these include your self-impression, your self-image and beliefs that you have about yourself, These include this self-consciousness and self-focused attention that you have. This also involves the negative automatic thoughts and images that happen, and also the behaviors, so these avoidance and safety behaviors that people with social anxiety might engage on more often. So, like we said, people with social anxiety tend to hold an impression of themselves that is very negative. And so as a result, they're very fearful that other people will view them negatively. And they also tend to have strict beliefs, such as high standards for how they think they should perform in social situations, and have strong beliefs about how they think other people will respond to them, and negative beliefs about themselves as well. And so, having a negative self image can prompt you to behave in very unhelpful ways. And our beliefs can be so strong that they feel like facts, when actually they're more like opinions that we have. And if your self impression is not entirely accurate, this can definitely put you under a lot of unnecessary pressure. So, there are also negative automatic thoughts that people with social anxiety have in social situations. And these include predictions such as, oh, they'll think I look anxious, worries, what if I say something and nobody replies, judgments, oh, I'm making such a mess of this, doubts, I'll never be able to do this. And really, negative automatic thoughts and images aren't always accurate, right? And people with social anxiety often fall in the trap of this emotional reasoning, which is really feeling something and thinking that it must be true because it feels that way. And if you pay attention to how you think you're coming across to other people, then you might focus your attention inwards, towards your own feelings, thoughts, and judgments about your performance. And some people say that they do this so that they can even catch themselves making mistakes before other people notice. And self-consciousness, is the opposite of what a performance enhancer really do. It's worse because it really gives you a biased impression of how you are really coming across to other people. And, if you are socially anxious, you might avoid situations that might make you feel anxious. So you engage in avoidance, or you might do things to control how you come across to other people. So engage in these safety behaviors. And you might also, such as you might stay quiet in groups or ask questions to keep the attention away from you. And so the avoidance and safety behaviors are well intended because they will decrease the level of anxiety that you experience, but they can also lead to a lot of problems. So they can prevent you from learning the truth, knowing what would actually happen. They might heighten your self-focus. They sometimes lead to the result that you were trying to prevent. They can make you appear unfriendly or uninterested, and they can actually draw more attention towards you. So that is everything for part 1. So please join me for part 2, where we'll be discussing different treatments for social anxiety. Thank you.